Birth control pills. What are the contraindications? Interview. In which cases should this method of contraception be avoided? Answer with D. Mounier-Véhier, cardiologist. Dr. Claire Mounier-Véhier is a cardiologist and head of the Vascular Medicine and Arterial Hypertension Department at the Heart and Lung Institute of the Lille University Hospital. It answers 3 questions you may have about the risks of birth control pill. Le Figaro. On the cardiovascular level, is the contraceptive pill still a problem? The answer is N. With the exception of injectable forms, contraceptives composed only of a synthetic progestogen are SAF. For pills and other contraceptives, patches or rings, that combine synthetic estrogen and progesterone, the risks depend on the composition and dosage of the estrogen. Ethinyl-estradiol activates, in fact, the production in the liver of coagulation proteins and of a hormone at the origin of certain forms of hypertension. Hence the risk of cardiovascular accidents beyond the 30 micrograms, more or less intense depending on the type and dose of the associated progestogen. These risks also increase with age and exposure to other factors: hypertension, diabetes, smoking, obesity. Thus, in a 30-year-old woman, the probability of having a myocardial infarction is multiplied by 2.2 under estrogen-progestin contraception, but by 10.6 if she smoke. And at age 40, the numbers jump to 7.1 and 58.6 respectively. The deleterious effect of tobacco is enormous. What are the risks and contraindications of these combination pills? The risk of thrombosis, phlebitis, embolism and other accidents affecting the veins is 4 to 8 cases per 10,000 women on the combined pill, but it is increased the first year of treatment, hence the importance of consultations during the first prescriptio. Both the doctor and the pharmacist must imperatively ensure that there are no contraindications, and therefore take care, among other things, of smoking, arterial hypertension, diabetes, obesity, presence of migraines with aura or certain cardiovascular diseases, childbirth shortly before, or even arterial accidents, infarction, stroke, et. In the father, mother, brothers and sisters before 40/50ths of a year old. In fact, estrogen-progestogen contraception only exposes you to a risk of arterial disease if these contraindications are not taken into account. Finally, all risks disappear when treatment is stopped, and there is no impact afterward. If you opt for combined oral contraception, which one should you choose? The least risky estrogen-progestogen pills are the second-generation ones, because their progestogen, levonorgestrel, is the one that least potentiates the toxic effect of ethinyl-estradiol, and for those who tolerate them badly, the third and fourth-generation combined pills are only prescribed if their personal risk of a cardiovascular accident is very low. But the rule for prescribing contraception is on a case-by-case basis. The patient must be questioned, in particular about her tolerance to side effects, breast tension, libido, mood, et. And if necessary change contraception by checking the risks again. The pharmacist must also be associated with the step. Finally, beyond contraceptives based solely on progesterone, and more or less well tolerated, weight gain, we come back to contraception by intrauterine device, that is to say the IUD, with or without local delivery of progestogen hormone, including in young women who have never had a chill, not to mention the condom, more than recommended in the event of a new relationship to protect against sexually transmitted disease.